Chicago's Morning Answer continues next in our AM 560 Weather Center. Could be some severe storms later in the afternoon. Otherwise, partly sunny, hot and humid, high 92. Warm and humid with thunderstorms expected overnight, low 72. 77 at O'Hare. Next news at 7. Chicago's Morning Answer with Dan and Amy continues next on AM 560, The Answer.
This hourly segment is brought to you by Papa Nicholas Coffee. Papa Nicholas, great coffee, period.
This is Chicago's Morning Answer.
You know, this show isn't for everybody. If you're not interested in the truth, if you're not interested in having a conversation on the merits, then don't listen to this show.
On AM 560.
Because there's no place for you here.
The Answer.
Good morning, Dan and Amy. We were talking about school reopenings in the context of COVID-19. Continue our conversation with a more global perspective, both geographically as well as on the many issues under the umbrella COVID beyond school reopening. To help us do that, we're pleased to be joined by Peter Collignon. He's an infectious disease doctor and microbiologist at the Australian National University. Dr. Collignon, thanks for joining us. Appreciate it.
Thanks for having me.
So I'm a bit perplexed. We mentioned this in passing, talking about school reopenings. New York Times, Sweden has become the world's cautionary tale. The data, Sweden's lowest death rate since early May. It is testing as much as Germany is on a per capita basis, one of the more heavily tested countries along with the United States, and yet its cases fall as well to its lowest level since May. So was the sort of soft touch approach of Sweden, has that proven just as effective as if not more so than the lockdowns when you include the trade-offs, the consequences of the trade-offs based on the decisions that were made? Or is Sweden a cautionary tale, as the New York Times reports?
Well, from the perspective in Australia, I think it's a cautionary tale. Their per capita death rate is 50 times higher than Australia. Their population is 10 million, while ours is 25 million. Yet they've had, I think over 4,000 deaths, while we've only had 106 deaths so far here. Now, we've had a bit of luck, I think, in Australia because we didn't have the virus probably circulating for a couple of months, which I think was the case in Europe and probably the US before it was discovered. And it may also have been lucky that we had warmer weather when it was, because we're in the southern hemisphere. Mm-hmm. And most of the people that got it were returned travellers from predominantly the US and Europe. And we were able to close our borders very early, contain the returned travellers, quarantine them, do a lot of testing, so that it ended up that about 70 or 80% of the cases we had originally were returned travellers or returned cruise ship people who, and then their immediate contacts. And we had very little community transmission here. Now, I might say it's changed a little bit because we're in winter and Melbourne, a city of 5 million people, is now having an outbreak, but still relatively compared to other places in the world, they might have had a couple of thousand cases over 5 million, and with extensive testing. But it is actually spreading in the community. We hope we can control it again. But we've been in a much better position. We haven't had a lockdown and close everything, for long periods of time, and we've had a much lower death rate so far and a lot less cases. So the hope is, and maybe it's because we're an island nation, that we can actually contain this to low levels. Some people even talk about elimination, but I think that's not realistic. But at least we can get it down to low levels. So, I live in Canberra. We've got about 500,000 people, and we've had minimal community transmission here, 5 cases, in fact, over 3 months. All the rest have been people who have come in from overseas, and we've been able to quarantine them. So far, we're in a good position without doing the total lockdown like New Zealand did for long periods of time, but also without the large number of deaths that they've had in Sweden. Yeah. And we've been able to keep
most of those deaths, about half of their deaths are from nursing homes. And their nursing homes are different than nursing homes in the States, and I don't know about Australia, but they'll have hundreds of people in a nursing home.
No, that's true. And there's no doubt, like I presume the US, the majority of the deaths we've had here are in 80-year-olds and over. If you in Australia have COVID, you've got about a 15% death rate, while if you're you're under the age of 40, in fact, we've had no deaths. But also, if you look at, and you can argue, well, is this just sort of worse than flu? Well, yeah, it behaves like influenza because the death rates are predominantly in those very old and with underlying conditions. But it's also 10 or 20 times probably higher death rate than influenza, if for a person who gets infected. Now, I think it's more controllable than influenza is the good news, because particularly children don't seem to get it as much, children under the age of 15.
Yeah.
They still can get it and they can get very sick, but their rate of infection is 5 or 10 times lower than their parents if they're in their 20s and 30s. So they, if you've got a lot of infection in your community, yeah, children will get it too. But the good news is that they aren't getting it as often, and that actually means schools, at least for those under 15, are not a big factor in spread. And it also means that you can, keep schools then open if you haven't got a huge amount of community transmission, and not interfere with their education and keep people in the workplace, etc. So that's the good news, and that's quite different from influenza. Influenza children tend to get it 5 times more than adults. Well, this is the opposite.
Yeah.
Now, we don't quite understand why, but it's good news.
Yeah, well, and just on that point, I mean, there's a couple points I want to make. One, on that point, yeah, 5 times more likely, as you said, with the flu for kids, and yet we're locking down schools ostensibly for the kids. It's a bunch of nonsense is what it is, and this is what Dr. Scott Atlas called it, the dumbest public policy in modern history, and I don't think he's overstating the case. Number one. Number two, on Sweden, just in terms of comparing to other Western European countries, a confirmed case fatality rate is a fraction of UK, France, Spain, and in addition to the overall deaths per 1 million is less than other lockdown countries, including the UK. So it seems to be that this is a bit more complicated than just looking at lockdown versus reopening, particularly when you're only looking at COVID and we're not talking holistically about deaths of despair as a result of lockdown policy, and including that in lockdown states versus, or hard touch versus light touch states, as well as the reordering all of healthcare infrastructure to COVID-19 patients to the exclusion of elective procedures or even processes, checkups, and so forth. Yeah, but it seems to me that this is such a wildly different approach to a pandemic than we've taken before. And there's not a very good real-time assessments that are comprehensive in nature. We continue to be completely COVID-19 tunnel visioned.
Well, I think that is a problem with a tunnel vision. I mean, in my mind, there's no doubt that COVID is, much worse than influenza, but might spread a bit less, which is good news. But the real problem is if you really lock down hard, you might find you get increased deaths from everything from suicide to, heart disease, cancer not being treated properly. So at the end of the day, you've got to look at the total amount of deaths or total number of deaths. And at least the English data I've seen, a lot of the deaths that are occurring that are increasing are not COVID, at least as far as they can tell now. Now, one of the issues is what is the mortality rate. Now, perversely, places like Australia and Korea, where we haven't had uncontrolled spread, I think are good ways of looking at that relatively. The death rate in Australia is about 1.2% of everybody that's got it. You've got to adjust that for age. And one of the reasons Singapore looks as good from a mortality rate is because their spread has been predominantly in their migrant workers who are living 20 or 30 people in a room basically, and because they're young, their mortality rate is really low. So if you get a lot of cases and it's young people, your mortality rate would look good. Relatively, mortality rates have looked higher in a lot of places, and I suspect the US is like that because so many mild cases weren't picked up initially because there's overwhelming of the system. Once you get more testing and you're picking up those mild cases, your mortality rate will look better. But at least as far as I'm aware, a lot of places in Europe and America have still got a much higher mortality rate than Australia. I think because still there were a lot of undetected cases. You tend to detect the deaths, but not what we call the denominator, the total number of people, because if a system is overwhelmed and you don't have enough testing, you just don't test those people, but they get better anyway.
Well, right. I mean, our CDC said last week This was when the case, the confirmed cases was in the 2 millions. They said, we don't believe it's 2.5 million. It's probably more like 20 to 22 million. Well, if it's 20 to 22 million that have been infected, if the CDC's guesstimate is right, that brings our case fatality rate down to like 0.06%, which is actually less than in the seasonal flu.
Yeah, look, I mean, I was originally under the impression that the mortality rate would end up about, 0.3 or 0.4%. Now, I guess we need to wait and see whether we got more cases that we might be able to tell from what we call serology and antibody tests. But even in Sweden, where they've done more of this, in Germany, that the death rate still looks like it's at least, 0.5 or 0.6%. You say, oh, that's low. But that's probably 10 times higher than seasonal influenza, over a population. So this is still a significant mortality any way you look at it. I think one of the reasons is seasonal influenza mortality rate tends to get overestimated because a lot of other causes, even the common cold, causes people to die in winter. Yet all the deaths are often said to be due to influenza, which I don't think is true.
Right, just like all the deaths in America are COVID-19 deaths. Even if you have 6 other comorbidities, if you test positive for COVID-19, then it's a COVID-19 death.
Is that what it's like in Australia?
Well, to some degree, that is true. But one of the ways I think we'll eventually work this out, and it'll be in about 3 or 6 months' time, is you can look over the last years how many people die. Every winter there's excess deaths,
right,
for lots of viruses. And the real issue is how many extra excess deaths we had in your winter and our winter coming, compared to say the last 2 or 3 years. For instance, in 2017 here, because our winter is obviously in June, July, we had quite an excess deaths because the flu season was particularly bad. But overall, that in Australia, that ended up about 1,400 extra deaths. So far from COVID, we've only had 100 deaths here. Now, winter is just coming and we've got this, outbreak in Melbourne, so I guess we'll be wiser in a few months' time because winter is more of a risk usually than summer, although it may be being inside is a risk because, interestingly, your northern states had much more deaths and cases during your winter, and now it's your southern states. And one of the theories is, well, when it's hot in the southern states, you go inside, and inside is a risk, and in the northern states where you couldn't go outside, I guess, because you freeze to death. So, I think a lot of these things will have to unravel, but there's no doubt that being inside is much more dangerous than being outside, particularly with crowds.
But coronavirus isn't going anywhere anytime soon, so we need to learn to live with this, correct?
Well, I think that's true. Basically, I think we should make the risk as low as we can for transmitting it, because I still think until we get a safe and effective vaccine, you're better off not getting it at all ages. And even though you're young and you get it and, your chance of dying is pretty remote, the trouble is, at least in Australia and I think worldwide, most of the people that get it disproportionately in their 20s and 30s who don't get all that sick and don't go to hospital relatively compared to the older, but they're the main way it's spread. And I think that's Sweden had that view that, look, we'll just protect those over 70 and everybody else go along their life normally. Well, at least in the short term, that's resulted in a much higher death rate than, for instance, in Australia and a lot of other countries. Now, we might have to wait a year or two before we really know what was the right way to go. But I think in the short term, we need to minimise the risk for all of us. And that basically is wash your hands, keep physical distancing as much as possible. I think if you've got a lot of community transmission, wearing a mask is a good idea, but so are face shields, because, those clear face shields, because they stop people spluttering over your face, but also if you cough or splutter, you keep it on your shield and it gives to others. And it stops you accidentally touching your eyes and nose all the time, which all of us do. And it's easier to wear for quite a number of hours without, fogging up your glasses and everything else that masks do. So they can have some practical problems. Plus, people can see your face. So if I was a waitress or a waiter in a restaurant, I'd be wearing one in any situation where there's a lot of community transmission. But we need to keep away from people who are sick, and people who are sick need to keep away from others, even in your same household. If you're sick, try and keep your distance, use a different bedroom, different bathroom until you get better, because the vast majority of this transmission is indoors by people who are sick or unwell that go to work or go to nursing homes and transmit it. So everything we can do to decrease the risk, we can't make the risk zero, but we can make it lower by doing basically things that our mother and grandmother would have told us to do for the last 20 years.
Yeah, so well, except wear masks. I don't remember my mom or grandma telling me to do that. But
Yeah, no, well, that's true.
but let's talk about transmission for a second. We talked about this 2 months ago, and I haven't, in the intervening 2 months, gotten a particularly good answer from the experts. So I wonder how you process this. We looked at the cruise ships. This is at the height of the outbreak, at least in the West. Princess Cruises, Diamond Princess ship, Holland America, USS Kidd, also two military ships where there was an outbreak. The Carnival Ruby Princess, the Royal Caribbean Ovation of the Seas. The infection rate where there was an outbreak on those ships ranged from 10 to 28%, with the deaths 43 out of 18,613 total passengers. But the overall infection rate about all those ships that I mentioned that had outbreaks on board. So people in close quarters for an extended period of time. And this is really before we had a full understanding of transmission or it was, as prevalent in the cognition of the public as it is now. The overall infection rate among those 18,000 plus passengers on those various ships was 16%. Close quarters, extended exposure, 16% positivity rate. How do you explain that?
Well, I think actually that's because this virus is not as infectious and not in aerosols, which aerosols mean small particles that stay in the air for hours. I think it reinforces again, this is mainly via droplets, which means the good news is you can do something about it. We had the same problem here with some cruise ships with 20% of the passengers being infected. Now, why is it so high? I actually think it's because you're actually in a confined space, and the death, again, disproportionately are the elderly. And
Right.
one of the reasons you may actually see so many cases on cruise ships is the crew is young, but they're in pretty cramped quarters below the waterline often.
Oh, yeah.
And I wonder whether it's because they're in relatively cramped quarters, they get a mild infection because they're younger, and they pass it on to the others because they're in close proximity when they're, waiting and things like that. So what that actually means is, yes, there is a very high transmission rate, and in China and other places where they've looked at household transmission, it's about 15% as well, which is people stuck together in small community, small spaces for, up to, 7 or 14 days.
Well,
it is surprising that it's as low as it is actually in some ways.
Well, yeah. My point is that the public perception of this is and we just heard this from Hollywood adults like Tom Hanks on the Today Show yesterday. The perception is if you come within 6 feet, if you pierce my force field, then you're going, and I'm infected, then you're going to get infected. 15% in these closed environments with sustained exposure would be shockingly low to a overwhelming majority of Americans. Shockingly low, because the message is you are going to get infected if you come within the magical, and it is magical, it's not scientific, magical 6 feet of someone who's infected.
Yeah, look, I mean, the 6 feet, or we have 1.5 meters here, isn't magical because it's all about droplets. Droplets is when you cough or sneeze, you produce these moderately larger particles that drop, and that's why they're called droplets. And the closer you are to someone, the bigger the chance it'll get on your face.
Why not make
But
it 8
is
feet
very
then?
tiny.
Why not make it 10 feet? Why not make it 15 feet?
Well, because you got to be practical.
Oh, we
If
do
you
have
make
to be
it that-
practical. Yeah.
Well, I think we do have to be practical about it. You've got to come up with a measure that decreases your risk in a large proportion without paralysing society. I mean, the reality is we're going to have this for a couple of years. We're going to have to reduce our risk. We can't make it zero. And we've got to come up with some number that is practicable to live with without, all of us becoming hermits for the next 2 years, which is impossible. So, and 1 metre actually is protective as well, but not as protective as 1.5 metres or 6 foot or 2 metres. Now, but the real issue is you don't just get it if you just glance past somebody, for 10 seconds. Our contact tracing in Australia is we got a close contact with somebody who's been within that space of somebody who's got COVID for more than 15 minutes. And people who do less than that, not that they can never get it, but their risk is much lower than somebody who's been in the same staff room for 20 minutes with somebody often who's coughing a bit and who's got COVID, and they're closer than one and two, or for you guys 6 feet. But the closer you are, the higher your risk.
I want to get.
Whether
I
it's
just
3 feet or 6 feet, it's
Yeah.
proportional. That's all.
Oh, okay.
Well, it's much lower after you get 6 feet, because these droplets, in fact, most of them drop within a metre or 3 feet. Some of them can go further, but the proportionality really drops fast. So being 6 feet away compared to 3 feet is not just halving your risk. You're probably decreasing your risk tenfold compared to being just 3 feet away.
From a minimal risk to begin with, as the Japanese point person for the COVID-19 response in Japan wrote in his op-ed in the Wall Street Journal, Mr. Nishimura, the Minister for the State's Economic Revitalization, as well as being the point man for COVID-19. And he said the reason Japan was able to be so successful against COVID-19 without locking down is that they realized something, that transmission happens in clusters. And so they focused on cluster busting, as he says, because 80% of people who are infected don't pass it on to anyone, according to his experience and what he reports in his op-ed. And so they focused on industrial sectors and clusters of transmission and put all of their energy into cluster busting. That makes sense?
Well, that is true. I mean, 20% of people cause 80% of the infection. The trouble is you don't know where the cluster is until after the event. So it still means if you want to decrease your risk, you need to actually avoid crowded indoor situations as much as is practicable and take those precautions, because, otherwise about it 2 weeks later when you found, there were 100 cases. But there are predictable things more dangerous, like Korea started.
Dr. Collignon, I'm sorry we're up against the clock. We got to end it there, but I do appreciate your time. Peter Collignon, doctor at Australian National University, microbiologist. Thank you so much for joining us. Appreciate it.
Well, thanks for having me.
And he joined us on our turnkey.pro answer line. It is 7 a.m. WIND Chicago.
A new coronavirus record. I'm Dave Anthony, Fox News. More than 60,000 cases reported in the U.S. yesterday. Texas set new highs in deaths and hospitalizations. It's all worrying a White House task force doctor. Fox's Tanya J. Powers has that live.
Dave, Dr. Anthony Fauci has some straight talk for states where COVID-19 cases are surging. He says if you don't admit there's a problem, you can't correct it.
If you do